Hello, I'm Jack Daly, an attorney and health advocate here in California that will provide information to you about two important and free resources to help you access the care you need from your health plan. In this video, you'll hear about a statewide health advocacy network that provides free legal representation to help people overcome barriers to accessing needed care. I'm also joined by Angelica Cano from the Department of Managed Healthcare, who will describe some of the many ways this important state agency protects Californians' rights as members of managed healthcare plans. First, a note about what I meant when I mentioned barriers to accessing needed care. How does an access to care barrier arise? Very often, access to care barrier will arise when a health plan claims a needed service, piece of medical equipment, or medical supply is not covered. Or a health plan may deny an authorization for a service or payment for a service that was already obtained by the patient. Also, it may arise when a health plan assigns a greater cost sharing for a covered service than was outlined in the evidence of coverage, or otherwise known as the health plan contract. A health plan doesn't believe a service, a treatment, or a medication is necessary. Also, it comes up when a patient cannot access a needed provider. And finally, we also see healthcare barriers arise when a patient does not have access to an available or qualified provider and requests authorization to see an out-of-network provider, but the health plan says no. Some of you watching today may have had these experiences or unfortunately may have some of these experiences in the future. Rest assured, however, that help is available. The Health Consumer Alliance, or HCA, helps people obtain the needed healthcare coverage and services while working to identify and address systemic healthcare issues impacting all Californians. The HCA provides legal services to consumers in all languages, regardless of income or asset level. We are an independent health consumer assistance program supported by federal, state, local government agencies, and foundations. Let's take a moment to learn a bit more about the Health Consumer Alliance and how you may receive help. Our Health Consumer Alliance is a network of health consumer assistance programs operated by 10 community-based legal services organizations across the state of California. We offer free education and direct legal assistance, including up to direct legal representation as needed. Consumers living in any area of the state can get individual assistance by calling 1-888-804-3536, selecting their language, and providing their zip code into the call system. The call system will then route the call to one of our local providers who can provide assistance. The HCA and the Department of Managed Healthcare have partnered since 2012 to provide consumer assistance to managed care members as well as community outreach and other education services. HCA's consumer assistance includes advice and representation to members to help submit Department of Managed Healthcare complaints and independent medical review requests. The Health Consumer Alliance and the Department of Managed Healthcare have partnered since 2012 to provide consumer assistance to managed care members as well as community outreach and education services. HCA's consumer assistance includes advice and representation to members to help submit Department of Managed Healthcare complaints and independent medical review requests. Co-location within nonprofit legal service organizations permits us to seamlessly connect consumers to legal assistance on a wide variety of legal issues. Let's learn more about the Department of Managed Healthcare and its important role as a consumer protection agency. Angelica?
Thanks, Jack. My name is Angelica Cano of the Help Center at the Department of Managed Healthcare. I'm going to provide a brief overview of the Department of Managed Healthcare and how you may engage the Help Center to raise concerns with your managed care plan. First, it's important to know the role of the Department of Managed Healthcare, or DMHC. DMHC is a consumer protection focused state agency that regulates managed healthcare plans in California. DMHC licenses managed healthcare plans to operate in California and has oversight and enforcement duties to ensure they comply with state rules. The DMHC's role touches nearly 30 million Californian lives by virtue of being the regulator for all HMO and some PPO and EPO products, some large group and most small group and individual products, most Medi-Cal managed care plans, dental, vision, behavioral health, chiropractic, and prescription drug plans. Also, Medicare Advantage for financial solvency purposes. The DMHC also has licensure and oversight role over health plans to ensure plans meet basic readiness standards to operate in California. This includes network readiness reviews, site visits and reviews, and enforcement actions. Finally, the DMHC Help Center processes, investigates, and resolves consumer complaints and requests for independent medical reviews through our Help Center. The Help Center assists members with healthcare issues and ensures managed care members receive the medical care and services they're entitled to. The Help Center is made up of the Contact Call Center branch, the Legal Affairs branch, the Independent Medical Review branch, the Standard Complaint branch, and the Provider Complaint branch. The Help Center assists members with healthcare issues and ensures managed care members receive the medical care and services to which they're entitled to. The Help Center is made up of the Contact Call Center branch, the Legal Affairs branch, the Independent Medical Review branch, the Standard Complaint branch, and the Provider Complaint branch. In 2023, the DMHC Help Center assisted 140,952 Californians and in the process helped return $9.1 million in plan benefits to Californians. This is just one of the many ways the DMHC touches consumers all over California. Rule check. Did you know health plans must ensure timely and geographical access to care? If you're experiencing delays in accessing care or being assigned to receive care that's too far from your home or work, or in any other way you are dissatisfied with your health plan, you may file a grievance with your health plan. If you receive an unfavorable outcome, do not receive a timely response, or disagree with their determination, you may file a complaint with the Help Center. How to file a complaint. You may submit your IMR complaint form online. It's available in English and Spanish and many other languages. You can also submit it by mail or fax. You'll want to ensure that you complete every single field, include any copies of supporting documentations, and sign the form. When it comes to timing of complaints, typically internal health plan grievances must be resolved within 30 days, after which a complaint to the DMHC Help Center may be filed. However, a member may skip a health plan's grievance process if there is an imminent and serious threat to the health of the member. Those types of cases are also known as early review complaints, and they can involve anything from cancellations of coverage, rescissions of coverage, non-renewal of a healthcare service plan contract, or any other case where the department determines an early review is warranted. Independent medical review. Any health plan determination for services related to clinical decisions that are not medically necessary are subject to review during the independent medical review process. During the IMR process, a medical expert will review the health plan's decision, the member's medical condition via their medical records, medical evidence such as medical articles, professional standards, and their expert opinion, and will determine whether or not they agree with the plan's determination. An independent medical review, or IMR, is a review of a complaint by an independent expert who is not a part of your health plan or the DMHC when there is a dispute about the medical necessity of a requested treatment or service. An IMR is free to health plan members. Approximately 72% of all IMRs are favorable to members. IMRs are just one of the many roles the DMHC plays to ensure managed care plans operating in California follow the law and deliver the needed care. If you would like to stay in touch with the department and receive notifications about public meetings, join our listserv. Thank you so much for watching. You can access additional information and take our survey with the QR codes below. Thank you.